cold hard truth. Everyone really want to know what's going on with her show. Just get on the air and you will know it's Sandra. The queen of the mile road is here, helping people from everywhere. Get on the phone and you will hear Sandra. Now she will tell you how it goes, but don't you ever step on her toes, 'cause you will hear the cold hard truth from Sandra. They say she's the hero in town, helping people from all around. You get a call, your money is found, it's Sandra. Some will call her late at night just to say that there is a fight, and she will not just leave it alone. She'll get up and call on the phone, and when politics starts on her show, everyone really wants to know the way the things will really go with Sandra. Some will start to criticize, get on the show and tell pure lies, but someday we'll realize it's Sandra. And when they start to argue again, she'll pull the heads to the wind, and soon you will be a friend of Sandra. 'Cause every day everyone wanna hear from Sandra. Every day, everyone wanna hear from Sandra. 'Cause every day, everyone got to hear from Sandra. 'Cause every day, everyone got to hear from Sandra.
Good morning, good morning, good morning, you beautiful folks. Happy Tuesday. It is Medical Rundown Tuesday. Hope everyone had a wonderful day yesterday. We have lots to cover today. We are so happy to have our special guest every single Tuesday, pretty much, in the studio with us, talking about all things, related to your health and wellness. And I absolutely love it. This is a topic, I find them all interesting. I got to be really honest with you. They really are, because I feel like I learn something every day. And this is one that I had an experience with last year that I've never had an experience with before. So I'm here to learn. I'm in learning mode again this morning. So let's go ahead and invite into the studio the Chief Business Officer for Health City Cayman Islands, Mr. Shamari Scott. Good morning, Senor Scott. How are you?
Good morning, Sandy. How are you doing today?
Oh, I'm doing wonderful. How about you?
I am amazingly well. So I have no updates because the last two games rained out for the over 40 league. So I
Oh
know you were
man.
hoping to hear about a victory, but we'll the Lord was judicial with us and made sure that we had an extra 2 weeks of rest. So both games have
Yeah.
rained out, so we're back at it tomorrow night. And prayers up that it's a nice dry court because you can't have people over 40 playing on a slick court. Because as you know,
Mhm.
sometimes we wake up on the wrong side of the bed and our necks and our backs and our ankles
Absolutely.
and our knees. So they're just making sure that the organizers are great, just making sure to protect all of our more,
Yeah.
gentle competitors know that we're at this age. But outside of that, everything has been good. It's amazing.
Fantastic. Fantastic.
And as you said, today is a great day because we're having on Dr. Ravneet Verma, who's going to be with us, and he's our consultant ENT. And as you mentioned, it's a great topic that has to do with nosebleeds. What we're looking at is, a lot of topics that traditionally people may not discuss or may not understand and just think, oh, it happens just because. We want to make sure that we're able to give information that everybody can actually have benefit of the information given. So Dr. Ravneet, sorry, has close to a decade and a half of specialist experience. He's a trusted professional. He's an expert
Mhm.
in ENT and skull-base surgery. And something interesting about him is that he's published over 25 research papers, and he's also authored two chapters in a surgical ENT book, just
Hmm.
showing you the broad level of experience that we have within our physicians at Health City. So without further ado, we can bring in the good doctor.
Yes. Good morning, sir. How are you?
Good morning, Sandy. Good morning, Shumari.
Morning,
Great to
morning.
be here. How are you guys doing this morning?
Yeah, wonderful. Thank you so much for joining us. And yeah, this is an interesting topic. I got to tell you, I'm tuned in. I want to hear more about this one. But ENT, you must have one of those jobs that people forget about you until they really need you. you know?
And and just to mention, Sandy, I know we're going to talk about nosebleeds, but just so folks can
Yes.
understand his full range of experience,
Yeah.
um, his areas of expertise have to do with endoscopic sinus and skull-base surgeries,
Mm-hmm.
hearing reconstruction surgeries, head and neck tumors, airway diseases, vertigo, voice and sleep disorders are just a few of his areas of expertise, even though we'll be speaking about nosebleeds today. Just wanted to throw that in
Yes.
as well.
Yep. Covers quite a bit. So very interesting. So let me just pull up our slides here. But do you think that most people, Doc, have probably had a nosebleed at some point in their life? Is it pretty common to maybe
Yeah,
have the one-off one?
one of one is very, very common. In fact, there's actually, we have like numbers. 65% of all human beings, at least once in their life, will have a
Mm-hmm.
nasal bleed. They may not be major enough for you to go to the hospital, stops by itself,
Mm-hmm.
but at least 65% of us will have at least some sort of nasal bleed. Like I've had one in my life.
Mm-hmm. Mm-hmm.
So, I mean,
Yeah.
it's, yeah, very easy to get one, very easy to
Yeah.
treat one.
Shamari, have you had one? Because I feel like you're one of those people who you've never had surgery. You've never.
No, that's the one that I've actually had before. I've had well playing basketball, right?
Yeah, you get
You
hit in
get
the
an
nose.
elbow to the face, and I've had nosebleeds. It was a little bit of an issue when I was in college. It bled
Mm-hmm.
probably continuously a few times before I could get it to stop. But then it went away. I never actually seeked any guidance on it, but it
Mm-hmm.
just naturally went away. Back then I would stay away from the doctor as much as possible when you're 18, 19, 20, 21, right?
Right, right, right. Yeah.
But yes, this is one of the areas that I've had quite a few nosebleeds earlier. I say earlier in my life, in my late teens. Yeah.
Mm-hmm. Okay. All right. So Doc, give us what is the medical term for it? You got to pronounce that one for me.
It's
Epi.
epistaxis.
Epistaxis. Word of the day, folks. Epistaxis. So basically, it occurs when blood vessels inside the nose rupture. And I guess we're going to talk about here in just a second all the different reasons why they could potentially rupture. But there's different parts. I mean, this is, again, fascinating that the nose, it looks simple, but it's a little bit more complicated. So most of them, it says here, originate from the nose anterior and are usually very mild. So that's like the front of the nose.
Yes. So
Uh-huh.
the nose itself has a very rich blood supply. So one of the
Right.
functions of the nose is to heat up the air when you breathe it in, basically temperature modulation, then moisture modulation of the air before it enters the lungs. So that's where your nose comes in. So it has a lot of blood supply and it's very superficial. Like under your skin, if you have a little scratch, you don't bleed much. And the nose, a small scratch can lead to a bleed. That's how superficial they are. And with most, as with most bleeding anywhere else, you give a little pressure, it stops. It forms a little clot, it stops. And we have mechanisms within our, blood to stop any bleed. And that's what happens in the nose.
Interesting. Okay. All right. Now let's talk a bit more about common causes. What happens?
So epistaxis has like a bimodal distribution. By that I mean it either happens in really young children or more commonly in young children or then in the elderly. The most common causes in the whole population would be dry air or really dry environment. As I said, the nose has this function of moisturizing the air as well. In the process, it can get dried up. And when this drying, the secretions dry up, they peel off, they can remove that superficial layer and cause a little bit of a bleed. In children, especially young children, the most common cause is nose picking. So children will put their fingers up their nose, and if their nails are slightly sharper, they might cause a little cut, and that's when they will have bleeds. So that's true for most children. Again, allergies, sinus infections will also cause a similar situation where there's a lot of inflammation within the nose, the blood supply is more, there are more secretions which can dry up, can cause a little bit of a bleed there as well. Same with colds. When you sneeze, you basically releasing that kind of the top layer of the dried up mucosa there. And then any trauma or injury, like Shomari said, even my bleeding was a little elbow to the nose. Again, it can cause a rupture of the blood vessel there. Now, while coming to the elderly part of the population, you have high blood pressure being the most common cause. Increase in blood pressure, very thin blood vessels in the nose, again, because of, you need exchange, so the blood vessels are thinner themselves, and that can lead to excessive bleeding. Also, use of blood thinner medication doesn't help you clot it very quickly, so that can lead to an excessive bleed. And nasal sprays, especially your decongestant nasal sprays, they can cause over a longer use, they can cause nasal bleeds as well.
Wow. Okay. So let me have that sink in. High blood pressure, blood thinning medication, and overuse of nasal sprays all sort of surprised me. The first one's probably not so much so, although nose picking, I didn't really think about it, but it makes sense with kids. So yeah, okay, interesting. And I've known for some time that overusing these nasal sprays is not a good idea. Like if you're having to rely on them a lot, you should probably come and see you, right? Because yeah, it's not good.
Yeah.
Yeah. Okay. All right. There you go, folks. Very, very interesting. That blood pressure, I tell you what, there's so many things that seriously impacts. It is very, very amazing. All right. So you get these bleeds. I guess the first, thing that you have to figure out is what it actually looks like, because there could be a couple different things that are actually happening.
So what we talked about in the first slide, right, was mostly about what are the most common causes. Of course, there are some other causes which can happen. So what you want to rule out is you can partially rule out things that could be in both nostrils versus one. So if you have bleeding, if you've had a prior history of bleeding, if you've bled like multiple times, that's more of a problem where you want to diagnose what's happening. As we said, the majority of the population is going to have one bleed. Like if you had a trauma to the nose, or even the nose picking is a trauma to the nose. So if you've had that, it's more like, okay, you scratch one surface, you stop doing that, it's going to stop, bleeding. But if it keeps happening, or if it's a heavy bleed, then you need to find out what's happening. So trying to find out which side it's happening from. Then did it happen by itself? Did you do something to make it happen? As and With excessive flow as well, is it going back down the throat? So identifying whether it's coming from the back part of the nose versus from the front part of the nose, where it'll bleed
Mhm.
more out from the front rather than go down your throat and make you choke a little.
Mhm.
And as I mentioned earlier, it's also the more common age groups are either children or the elderly, for the reasons I specified before.
Mhm. Mhm. All right, folks. And if you're listening to this program and you're very, very interested, you should know, number one, as you get a nosebleed, what is it that you do? So I was thinking about this. I actually had mine on a flight. And so I'm assuming it's probably because of the air pressure.
The air pressure.
That sometimes that happens. Yeah.
Yeah, you're right. And the immediate care. Now, this is something that's the first thing I tell everyone. If before even the consult starts, or we try and investigate what's happening, why it's happened, this is the
Mm-hmm.
first thing I tell patients, because this is where most people are getting it wrong.
Mm-hmm.
Sometimes even being told by family and friends to just put their head back. That's the worst thing you can do, because then you're pushing that blood down into your throat, which can cause a little bit of choking. And once it goes down your throat, you're going to cough, and that coughing is going to make you release that pinch that you have on your nose, and that's going to
Mm-hmm.
again continue the bleed. The cough causes an increased intrathoracic pressure that increases that blood flow temporarily, and that's going to cause to continue the bleed. And of course there are then problems with choking on your own blood. So the
Oh,
first thing is always just lean forward.
oh,
This is
wow.
what,
Okay.
yeah, this is called the Trotter's method, also called the Hippocratic method, where
Mm-hmm.
the first thing you need to do is actually lean forward, pinch your nose, and keep pinching it for at least 10 to 15 minutes, and just breathe through your mouth. I usually tell people just go and sit with a bowl, stand in front of a sink, just relax, let your body relax, because once you get the nasal bleed, sometimes people get freaked out, they're stressed, they increase their heart rate and their blood pressure. The first thing to do, lean forward, pinch your nose, open your mouth, breathe, relax, deep breaths, just keep pinching by the watch. Don't go like, okay, it's been 3 minutes, so I'm going to try and see if it stopped. You want to give continuous pressure for those 10 to 15 minutes, and then just keep breathing, and don't try to swallow the blood, don't try releasing just to check. And that, in most patients, in more than 80 to 90% of the patients, that
Mm-hmm.
is going to stop your bleed. As I said, single bleed once in a while is common, especially in drier weathers. People will get more nasal bleeding. So
Mm-hmm.
that simple technique at home, within 10 minutes, you can just resolve the nasal bleeding.
Hmm. All right. Well, I see. I was doing it completely wrong. As you say, we kind of, I don't know where I got that from, but we think that we hold our head back. So, folks, this is what you do. Immediate care, sit upright, lean forward slightly. Do not tilt your head back. So, I was doing it wrong. Pinch the soft part of the nose firmly for 10 to 15 minutes. I don't think I even did it that long, but yeah. Breathe through the mouth and avoid talking, swallowing blood, or checking too early. Yep, did all those things. And then I didn't have a cold compress, but of course, apply cold compress to the nose or cheeks if needed. Um, okay, wow.
Yeah. So temperature works in very
Mhm.
different ways in the nose. When you have apply cold temperature to the outer part of the nose, that's going to constrict the blood vessels and make them
Yes.
shrink. Now, inside the nose, if you put cold air, that's going to actually expand the blood vessels and cause more nasal bleeding. So we have to be careful that, while doing surgery, if we're trying to just reduce the bleed in the surgical cavity, we actually flush hot water, while on the surface we have to give cold any ice pack, cold towel or something that can be put. So people have used hot shower, like cold, really cold icy showers on your head, that can reduce the just the amount of blood that's going into the nose, making it easier for it to stop.
Mm-hmm. Hmm. All right. Fantastic. Wow. Any questions, folks? You can give us a call at 936-2626. The good doc is here to answer those questions for you. I'm just checking our social media feed. Good morning, Miss Faith and Hope. Evelyn is here, seeing if anyone. Now, Island Pearl says, I get them very, very often when I was younger, and then I grew out of it. Doesn't get them as often as an adult. So what causes some children perhaps to have them more frequently than others?
Yeah. First thing I said, like it's a bimodal distribution. Children are more likely to get it. A lot of times it's just nose picking. And
Mhm.
then the development of the system with the vasculature. So children will often get them more. They're not really sure of how to deal with their nose, so they'll go picking in them.
Mhm.
You're not taking care of your nasal cavity cleaning, so it
Mhm.
could be just dryness. A lot of times in children, the most common cause, as soon as the parents walk in, we say, "Did your child pick his nose?" And they're like, "Oh, we're not sure." But that is the most likely cause in young children, at least, because they don't realize. Then we tell them to clip the fingernails, make sure if it's happening again and again, make sure that the nails are clipped so that they can't go in and
Mhm.
injure their nasal mucosa then.
Mhm. Mhm. All right, Island Pearl, were you a nose picker? Just curious. Um, Now, we've already talked about what not to do, not tilting the head backwards, as this causes blood to be swallowed. Do not pack the nose aggressively with tissue, and don't lie flat,
Yeah.
because none of those things will help you. It
So
might make it worse.
yeah. So packing with tissue, like eventually,
Mhm.
if the bleeding doesn't stop at the hospital, we do nasal packing with specialized um, stuff, which is basically, absorbs the blood, puts pressure on it. But
Uh-huh.
packing the tissue at home can lead to a few things. One, the tissue can get wet. You can leave some of it inside, and it's going
Mm.
to cause irritation within the nose. So we don't ask anybody to, make sure you're not packing it yourself at home. If it's not stopping, pinch the nose, get to the hospital. While you're in the ambulance, just keep pinching. Like you'll see
Mhm.
the EMTs also telling, if you call 911, the first thing they'll tell you is pinch the nose, lean forward as well. Nobody will ever tell you to pack the nose. That causes more irritation. And when you remove that tissue, it might just dislodge the clot that has formed and again start the nasal bleeding for you.
Mhm. So one person says here, morning, just tuned in. My kids get nosebleeds all the time. One doctor gave me a cream to put in the nose to keep it moisturized. So, assuming that they're thinking it's because the nose is actually the nostril area is getting dry,
Yes.
which normally that happens too. Like if you've had a cold and it's extremely dry, that can also lead to like a nosebleed or constant blowing of the nose and stuff like that.
So here allergies also play a role.
Mhm.
In young children, it's really hard to diagnose an allergy, but if the parents have had an history with allergies, it's genetic, then we're looking more into that might be a lot of secretions in the nose. There are other causes. If it's happening again and again, and on examination of the front of the nose, it looks like it's absolutely fine, the mucosa looks healthy, but it still tends to bleed, that's when you want to investigate further and look at other causes. In children, like one of the most common causes of a nasal blockage is adenoid growth, which is at the back of the nose. It's very, very common in children. What that can do is lead to a lot of secretions getting built up in the nose, cause constant inflammation in the nose, and cause nasal bleeding as well. But we're not looking to diagnose every child with a single
Mhm.
one or two nasal bleeds. That we as The assumption is that that has happened because either nose picking, dryness of the nose. But if it is recurrent, that needs to be investigated further. we
Mhm.
there is a possibility you may not find anything, that it's just dryness due to allergies or due to just secretions or nose picking, which is, sometimes the parent, it's not happening in front of them, so they don't realize it. But yeah, you do need to rule out a few things before you definitively say, okay, this is just because of dryness.
Mhm. Mhm. All right. Um, So, when to seek medical attention? How do you know it's bad enough to actually do something about it?
So, number one, if it's lasting too long, you pinch your nose for 10, 15 minutes, it hasn't stopped, go to the hospital. First thing you should do. If it's very heavy bleeding, it's not stopping, it's like pooling up, it's going down your throat, like even when you're pinching your nose, it's still strong enough to go back. Now,
Mhm.
that can happen very often when the bleeding is coming from the back side of the nose, because pinching the front of the nose then may not help as much. Then if they're happening again and again and again, even though you don't have a current bleed, even then it needs to be investigated. So,
Mhm.
if it's happened, you've stopped it at home, but it's happened a few times, just go to the doctor, get it checked out. Then if you have any dizziness, any weakness or fainting, that means you're losing too much blood. So that again is an indication of going and getting it checked out. Of course, any trauma, if it's a minor trauma, bleeding stops, maybe you don't need to go in. But if it's any major facial trauma, that can cause significant nasal bleed, that could open up a major blood vessel within the nose, and that might need medical expertise to stop that bleeding. Again, any patients on with medical conditions like you know causing bleeding disorders, is bleeding or clotting disorders is what we call them. There are a
Mhm.
number of them. Patients on blood thinners, patients who have uncontrolled hypertension, all of these will be at risk of getting nasal bleeds again and again. That's what I see mostly at the hospital, with patients getting admitted with chronic conditions, having their clotting factors or their not being in the normal range, and that's where they
Mhm.
keep having bleeding. So that's where you need to go and seek medical attention, try and figure out what is the reason for you to get those bleeds, and try and fix that particular reason. There's no
Mhm.
blanket treatment after that. Right? You do a blanket treatment with the urgent treatment, and that's after that you need to diagnose what's going on to try and prevent any future bleeds as well as stop the current one.
Mhm. All right, we do have a parent who is listening to the program, and she has a question. Let me just pull it up here on the screen. Give me one quick second here. And it's around traveling, which again is something that we know happens quite frequently. So she says, I have a history of sinuses and allergies. And then her kids would wake up with nosebleeds, even in the middle of the night. Two of my kids had their, is that adenoids out
Yeah.
because of secretions. Once we were traveling, and as soon as we hit in the air, my daughter's nose started bleeding. Ask about traveling if you didn't already address this. So is there anything specific that you can do when on a plane in the air any differently?
Again, a lot of that happens because pressure changes, could be predisposed to being dry nose. So again, make sure the nose is moisturized. Saline nasal creams are available, saline nasal drops are available. That's the first thing that we advise. Again, with the pressure changes, your interthoracic pressure, the air pressure changing can cause a little bit of a bleed. So it's after a while, when you've had a few nasal bleeds, the child might feel a little bit stressed about the fact that they're about to fly, so that can increase their heart rate as well. So try to just make sure, calm the child down. Make sure you put the creams in or the nasal drops in, keep it well moisturized, and that should take care of it. But if it's happening again and again, you also need to do some blood work to rule out if all of their clotting factors, their platelet counts, everything that is within normal range as well. Like, we cannot ignore the systemic causes as well here.
Right. Okay. All right. Hopefully that answers that question for her. Morning, Miss Dean. Silent Pearl says they got advice that it was not a tumor. So how often? I mean, I know we're going to get into when it's more serious, right? But let's go through first when it is you really need to seek medical attention. So if it lasts for a longer period of time, more than 15 to 20 minutes, despite applying pressure, then that's an indication that it's a bit more serious. Yes, Doc.
Yeah. Oh, sorry, I thought I lost you for a second there.
Yes.
Yeah. So again, anything that lasts longer than it should, as I said, 15 minutes, it hasn't stopped, seek medical attention. If it's a very heavy bleeding, the blood's pooling down, it's going down your throat, Those are immediate medical attention needs. And then if you've had a few bleeds but you're starting to feel dizzy or weak now, like you had it at home, you had a couple 2 days, you had lost a lot of blood, you might be,
Mhm.
because of the loss of blood, you might be getting dizzy or weak and you might faint. So again,
Mm.
go to the ER at that time. And if you've had recurrent nasal bleeds, they stop but they're happening again and again, then need to go and see the ENT doctor to try and find out why it's happening. So it's more of a preventative as well as an active intervention. Again,
Mhm.
with any head injury, any facial trauma, that can lead to a lot of nasal bleeding as well. Now you can have nasal bleeding coming with, so after a head injury, if you have blood stained fluid coming, it could be the CSF, which is the fluid around the brain, that could be leaking in through the nose along with the blood. So we'll have to look at that as well. So you need to get that checked out. And
Mhm.
again, anybody with any chronic medical conditions, anybody with a family history of bleeding or clotting disorders, and anybody on blood thinners, hypertensives, they need to make sure all of their parameters are under check, because that can, so they need to be in constant touch with their general physicians or their doctors to make sure all of their blood work is always within normal range.
Hmm. Okay. All right. So Island Pearl says maybe it's sinus issues, which they still have issues with even today. Very, very interesting. Okay. So any of these folks, this is when you've got to go to urgent care, go to the ER, and of course the doctors are going to be there able to assist. Underlying issues, when underlying issues are likely. So let's talk about some of these. Frequent or recurrent nosebleeds, not occasional. So
Yeah.
the more frequent, the more you should be concerned.
So when we talk about recurrent nasal bleeds, which are, see, it's happening again and again, whether you're able to stop it or not, that it becomes irrelevant at that time. If it's happening every few days, even every few weeks, so there are local causes that can cause this. So, for example, a tumor, even large adenoids, which are infective in the nose of a child, they can keep causing it. Any tumors, so there are specific tumors which are made out of blood vessels, and angiofibroma, which is specifically in young adolescent males. Um, in those cases, again, that needs to be investigated and treated, so they can keep having recurrent nasal bleeds. Then all the tumors or cancers in the nose are extremely rare, but they can happen. You need to rule them out. But the most common causes out of all of this would be elderlies who are hypertensive will have bleeds from the back of the nose. That is actually one of the more difficult ones to treat, because their blood vessels are thinner, their pressures can suddenly increase, so they may not be increased when you check them, but if there's a sudden spike, that can cause a nasal bleed. And then you have anybody with allergy or sinus issues, when the nose is very inflamed, there's a lot of secretions, the
Mm-hmm.
secretions drying up, peeling off, and with the inflammation also comes an excessive amount of blood flow to the nose as well. So that's
Mm-hmm.
the physiology, is that if there's inflammation, there's going to be more uh, blood coming out. And then, as I said, these are local causes, and then there are systemic causes where the blood is not clotting itself very well. And again, so there are a bunch of diseases where there are genetic diseases which can cause this. There can be deficiencies, so vitamin K deficiency, which can cause this. And then you have people with liver disease will have recurrent bleeding issues. And then you have the hypertension itself can cause nasal bleed. So those are systemic causes which are leading to nasal bleed. So nasal bleed in them is a sign of a problem that's happening in the rest of the body.
Mm-hmm. Hmm. Okay. All right. Wow. Let's okay, yeah. Very, very, very interesting. All right. So possible underlying causes. So we've already talked about hypertension and high blood pressure, and they're actually bleeding disorders. What sort of bleeding disorders are we talking about here?
So there are a lot of genetic bleeding and clotting disorders. So
Mm-hmm.
there's a cascade of events that happen for the blood to naturally clot. So anytime we have a bleed, we see a clot forming, and that's what puts the pressure and stops the bleed. So there is components in the blood called fibrin and thrombin, which are released when these cells need when the blood needs to clot. Now, if there's any deficiency of any of the factors responsible, that can lead to the blood not clotting properly on time. And these are put broadly under bleeding and clotting disorders, which are again could be genetic, could be acquired. And that's what needs to be ruled out. So you'll need to do some blood work, try and find out which factors. So there are factor 5, factor 9, factor 10, factor 11. A lot of these small, as I said, it's a cascade of full chain of events. If there is any component missing in any in the chain, that can lead to that chain not completing itself and the blood not clotting. So there are, as I said, genetic disorders which can be transmitted. So if you have a family history of nasal bleeding, that needs to be investigated. And again, any sort of disorders which can be congenital may not be genetic as well. So a lot of these bleeding disorders are usually just components of the cascade which are missing. Most of these, when they're slightly, it's tough to diagnose them, but once diagnosed, you can provide certain treatment options, replace those factors, and make the bleeding go away.
Okay. All right. Very, very good. Thank you so much for that. Potential complications. So if you have, constant nosebleeds or they're excessive, these are some of the things then that you've got to be concerned about.
So again, that anemia can arise, right? You lose more blood, you're going to have anemia. That's as simple as that. Blood can replace itself within 2 to 3 months, like however much you lose. So you can donate blood, it'll get replaced eventually. But for the time being, or if it keeps happening again and again, that replacement cannot happen on time. People who are already anemic, they will be at higher risk, or they're borderline anemic. If your hemoglobin is already low, you lose more blood, it's going to get down to dangerous levels. Not just with nasal bleeds, with any bleeds, that's going to happen. Again, you have very high risk of if there are severe bleeding, again, you can choke on your blood. Constant blood flowing can lead to a lot of blood loss, right? And also going back into the throat, that's the first thing we talked about. Do not lean your head back, because that's going to cause choking. So if you aspirate it, that's what aspiration is, when it goes into the lungs. Now it can cause major damage to the airway and the lungs. If you do that, again, you're going to cause coughing of the blood and all of that as well. Then if you constantly cause trauma to the nose, if there's constant bleeding and you're trying to always pack the nose, there's always clotting in there, that's also going to lead to constant inflammation, constant irritation, constant trauma. And with trauma comes some scarring within the nose as well. Even that can happen. And then you're, as it says, missed underlying conditions as potential complications, but that's more of a reason for having a nasal bleed rather than a complication from it. But most complications would be what you would imagine any excessive blood loss would cause you, right? So you can get dizzy, you can start having dizzy spells, you could potentially fall down. If your blood bleeding disorders and the clotting disorders aren't diagnosed, that can lead to, so as I said, nasal bleeding could be just a sign of another disorder, a systemic disorder. Now that bleed could potentially happen in another area as well. If that bleed happens in the brain, that's a hemorrhagic stroke. That bleed happens internally, you're looking at internal bleeding. So ruling out these systemic causes because you're having recurrent bleed also helps prevent these other major complications that could happen in other parts of the body.
All right. So, folks, that's why if it's anything serious, you got to get it checked out, because it could be an indication of something else that's going on. So how do we prevent them? Some good prevention tips here.
We already talked about, keeping nasal saline sprays, saline gels are available. So you try to keep it moist. Again, if you live in an environment where it's more dry, so what happens in even colder countries, you'll see that people actually have more nasal bleeds, and they would blame the cold. It's actually because you have the air conditioning on, heating up your house, that actually leads to more dryness of the nasal mucosa and causes nasal bleed rather than the cold itself.
Mm-hmm.
So, if people who have recurrent nasal bleeds because of inflammation or because of dryness, they can actually get a humidifier for their houses and make sure the moisture levels in the air are good. Then again, picking of the nose is the most common cause in children, not as common in adults, but can happen. Again, if you've had a little clot in the blood, if you have allergies, or if there's inflammation in the nose for any other reason, then
Mm-hmm.
blowing too hard can actually lead to dislodging of the dried up crust that you might have, and that can lead to
Mm-hmm.
nasal bleeding as well. So you need to avoid forcefully blowing the nose, and then you manage your allergy and sinus condition. So local causes within the nose, we need to treat
Mm-hmm.
those, manage them properly. Then the medication in the nose. Now there are hemocoagulase nasal drops which help clot the blood, which are to be used when you have a nasal bleed. But sometimes we prescribe somebody one of those, and they'll use it as a preventative thing, which is not really going to work. So just some saline nasal drops. If you have allergies, you might need, the nasal sprays which are safer, which are not over the counter. You need a prescription for those nasal sprays, and you need to use them to keep your allergies away. One of the most
Mm-hmm.
common ways to treat your allergies is actually to identify what you're allergic to and try and prevent your exposure. So prevention should always be the first step in managing your allergies. Um,
Mm-hmm.
the least talked about thing is your hydration. As I said, dryness is causing this. So if you're not
Mm-hmm.
hydrating yourself well, it's going to cause a bunch of problems, even everything from acid reflux to salivary gland
Mm-hmm.
stones, nasal bleeding, and I'm just talking about the ENT conditions, which
Mm-hmm.
can happen more when you're dehydrated.
Mm-hmm. On that note, I'm taking a sip of my water right now. Thanks for the reminder, Doc. So, wow, very, very good. And of course, also controlling your blood pressure if it's elevated.
So again, all systemic causes need to be ruled out. You need to, if you have been diagnosed with high blood pressure. So what I've seen a lot of patients do, they'll come and they'll sit and they're like, I've got your blood pressure. When we check it, it's really high. It's 180 by
Mm-hmm.
100. And they're like, no, I'm not hypertensive. It just
Mm-hmm.
occasionally it goes up. So when you're getting any of these rises, sudden rises, that can cause a nasal bleed. When you check it,
Mm-hmm.
an occasional, like let's say you check it 10 times, it's 5 times out of 10, it's raised, then there is a problem. So I always tell them to get back to the GP, talk to them, find out if there's anything that needs to be done. A lot of hypertension, like early
Mm-hmm.
hypertension, can be managed by, controlling your diet, getting some exercise. So more conservative means you do not need to get on medication, but you do need to
Mm-hmm.
get on a healthier lifestyle, get recommendations, try to work on it. But ignoring it is never going to solve your hypertension.
Yep, so true. Very good. Wee, good morning to you. Any questions from our audience? Everybody seems to really be paying attention here this morning. Somebody says he looks like the doctor who did my daughter's tongue tie surgery. Do you do that? I don't even know what that is, but
Yes, we
do
do
you?
that as well.
Oh,
So
okay.
yeah, as young as a few days after birth to adulthood.
Okay. All right. So it's possible that he might have been the physician that did that. So, very good, folks. Here we're talking about nosebleeds, but of course, the good doctor is an ENT consultant. So, yes, he does more than just nosebleeds. There's everything connected. And it's always so amazing to me, Doc. I didn't realize this until I had a root canal one time, and then I got a sinus cavity infection because of it. And I was just really blown away by, it does make sense now that I think about it, but how everything in the head is interconnected, right? So the nasal cavity is like right there. You do anything to the mouth, you potentially impacting your nasal cavity, your brain. It's all not far apart. So, that's why things like, serious tooth infection, you should never take that lightly, because that can actually cause inflammation and infection in the brain that could be deadly. There's just so many things going on. And that's why having the experts on is always wonderful to hear from them.
So again, that's actually a really good point. So when we have an isolated maxillary sinus, which is the cheek sinus, isolated on
Mm-hmm.
one side, just as this, we do a scan and we find one of the teeth might be going into the sinus, or the upper jaw teeth can sometimes go
Mm-hmm.
into the sinus. So
Yes.
instead of just treating that, we always send them to the dentist to get them checked out if there is a tooth problem that's actually leading to a sinus problem or not. And
Mm-hmm.
again, you might have a nasal bleeding because of that. So that could have potentially originated from having a caries in the tooth.
Yeah.
So
Wow.
there are rare causes. I failed to mention, which I should, is in children, especially if you keep having nasal bleeding, especially from just one side, and there's a lot of pus like discharge coming, it could be a foreign body that the child might have introduced into the nose. They never told their parents, or they forgot about telling their parents,
Mm-hmm.
and that can cause a lot of inflammation, and infection builds up, and then they'll start having these nasal bleeds. So please do not ignore that. That also needs to be checked out. It's pretty easy to take them out, but we just need
Mm-hmm.
to identify if that's the problem.
Mm. Shamari, you've got boys. Any of them ever stuck anything up? As he was saying that, I remembered one time we had to take my daughter she's very young, but we had to take her to the emergency room because she stuck some toy. I can't remember what it was now, up her nose, and we couldn't get it out. So we had to take her to the doctor and they had to take it out. Did you ever have any of those things, Shamari, with boys especially?
It sounds familiar. I'm trying to remember which child, because three boys, and
Yes.
having Lego, and all three at some age were all over the Lego. I recall an incident with Lego, but I
Yeah.
can't recall which of the three. But
Yeah.
yes, I've had Lego incidents with, you know, cavities.
Yeah. So, yeah, the emergency physician had to take it out and she was not happy. We're like, just calm down. And, wow, kids. Mm-mm. All right. Well, thank you, Dr. Ravneet. And I feel like this is his first time on the program. So warm CMR welcome to you, sir. And we look forward to having you back to talk about some of the other areas that fall under your expertise as well.
It was my absolute pleasure to be here and talk to you, and with your with everyone who's following the program.
Yes, thank you so much. Shamari, anything else that's worth mentioning? I learned a lot today.
Yeah, just today is my 18th annual 30th birthday. So,
Wait a
you
minute.
know,
Today's your birthday?
Happy birthday.
yeah, 18th annual 30th birthday. So,
Well, why didn't you tell us
um,
that at the beginning of the
I
show?
you
Happy
know,
birthday.
Happy birthday,
I
Shama.
will. No, thank you. I'll go have some cake later.
Yes,
So there's a hot
happy
cake, Shama.
birthday. This is great. Wow. Well, I hope that you enjoy some of it. I know you're always working hard. I'm sure enough, Facebook says, yes, today is his birthday. So happy birthday, Shamari.
Yeah, I was
All the
telling the
best
truth.
to you.
I was telling the truth.
I'm trying to see if I can get your real age. I got it.
18th annual 30th.
Yes. But yeah, happy birthday to you, Shamari. Enjoy your day for sure. Thank you
Definitely.
guys
And
so
always a pleasure
much.
to be on here. Thank you.
Absolutely. Thank you guys so much.
All right, thank you
All
for
right.
having me.
Shamari snuck that in there at the last minute. Yeah, so if you see Shamari today, wish him a very happy birthday. In fact, the whole week. I take the whole month now, the whole month of August. I'm like, yeah, I'm just gonna claim it. So, you gotta take your time working through all the lunch dates and there's only so much cake you could probably eat at one sitting. So there you go. I'll have a piece of cake for you, Shamari. It's on me. All right, folks. Yes, Evelyn says, happy birthday, Shamari. Barbara G is in the house. Good morning, Barbara. Wee is here. So we're going to just bring you guys up to speed on a few other little things that are happening in the community. So let me just see here. I don't know if you guys saw, there was a video circulating yesterday of apparently some women fighting. It's ridiculous. Oh, somebody said he's been on at least twice before. Really? Okay. He looks fresh. Yeah, okay. Well, I thought he was new. Well, thank you, Dr. Ravneet. Appreciate you coming on. Yes, but we've had some videos circulating. Oh, you guys are so silly. I don't know what to say. If you're supposed to be a grown woman, there are probably certain things that you just shouldn't do in public. And going out there, rolling on the sidewalks, fighting other women has got to be at the very top of your list. Stay home. I imagine that most of you are probably mothers. Yeah. I mean, but you know, it's ridiculous. It's embarrassing. What are you guys fighting about? Oh my gosh. When I saw the video, it's only, what was it? 12 seconds or something. There's not much to it, but man, I had to sit there and really shake my head because, you know, these women have their underwear showing, those who are wearing it, their butt cheeks out. And I'm just like, why? Why are y'all in the streets acting like you're crazy? What? It's loco. Do you guys want to see it? Oh, I can't even be bothered. I'm just, these women are just crazy. All right, I'll show it to you. I don't think there's any profanity in it. It's just ridiculous. I have to just sit here and shake my head when I see stuff like this. I don't know what else to do. But here it is. I'm going to just mute it because they're just doing a bunch of screaming and yelling. But you kind of get the idea. Weave pulling. For as much as you guys pay for this weave, I mean, low key, I wouldn't want anybody pulling on my weave if I wore weave, which I don't, but I'm just saying. Doesn't this stuff cost a lot of money? And then you guys got people pulling on it, pulling out your weave, pulling out your real hair. I mean, this was a straight up brawl. How many women are fighting? Let's see if we can count how many women we got. We got those two in the background. And then we've got at least 1, 2, 3, 4, another 5 in the front. And then another one coming in, another 2 coming in. So I think it's about 6 or 7. My gosh, I can't even figure out who's fighting who and what's going on. And they got on their little batty riders. Look at them. And then you got those 2 in the background. So, yeah, we've got lots of weave, lots of, like I said, the short shorts, the underwear showing. I'm like, oh my God, what on earth? Ladies, why? And everybody wears slippers. Is that a thing now? When you guys go out, back in the day, you know, y'all used to be wearing heels and dressed up a little bit. I guess everybody tries to dress a bit, you know, like you work in the back a road. And so back a road requires slippers these days. You don't wear like closed-toed shoes or heels or anything anymore. Every single person in this video is wearing a slipper. I'm just making a very odd observation, but they're all wearing slippers. Look, even the 2 in the background. They're fighting and wear slippers. Is that a guy that comes in at the last minute with the red and black? Let me see. I think that's a guy. He's heading for the 2 in the back to try and separate them, maybe. Let's see. Here he comes. Hold on. Okay, there he is. Yep. That's a guy come rolling in. He's like, I got to stop these 2 from fighting. Forget about the 5. I can't help them. Wowie. No, sir. Y'all got to do better. Take it to Jesus in prayer. I'm going to give you some advice from Aunt Lottie. She would tell you, take it to Jesus, honey child. Y'all got to do better. Ooh, lemon raspberry cake for spring. I'm going to send this to my aunt because she knows I love lemon and I love raspberry. And wow, I can totally see her. Aunt Adonia, I can see you making this cake for me. I'm just saying. I love to send her little cake recipes and stuff. It's like a challenge. So I'm going to send her that one. All right, so good stuff. Fantastic. Yes. All right, don't forget, if you've not signed the Larry petition yet, by all means, please do so. Oh, someone's asking for the doctor's name. Hold on. I'm going to type it here. It's Dr. Ravneet. So it's Ravneet, and Verma is the last name. Dr. Ravneet Verma. Go check him out. ENT consultant there at Health City, Cayman Islands. Oh, it's back road, not back a road. How you know what it is? I'm just curious. Yeah, Strong Wilt says they look like stray animals. Not even stray animals be going on. You'd have to be like a badger. You know, like there's some animals who are just known for being really, really bad. Badgers they fight for anything. Badgers are like badass. Like and they just be scrawling each other up. That's what they look like. A bunch of badgers. Oh, Irvin says them ghetto rats, right? Lord have mercy. I don't even know what to say about them. I just, when I saw it, I could just shake my head and I was like, yeah. Anywho, Sarah says, let me guess, the men they're fighting over just standing there laughing and taking the videos. Come on, ladies, you're better than that. Well, we want to hope, Sarah, that they're better than that. But honestly, sometimes low key, I'm like wondering if they really are. I'm just saying. They all look under 25, says Island Pearl, shaking my head. Let me just see if I can turn on my foot thing here. Give me 1 second. I'm going to increase the temperature. I'm doing my little foot soak, my Epsom foot soak this morning. Kind of feel like I've needed it. So you guys know me and my feet problems. I'm increasing the temperature. 118 degrees. Hold on. I think that's as high as it goes. I'm going to keep it as warm as possible. There we go. I'll put it 117 degrees. Yeah. So I must say that I told you guys about this Epsom salt lotion that I've been using. It does help significantly. It's not 100%, but you know, for me, even an 80% improvement, 90% improvement is just amazing. So I still try to do my other little stuff, including the Epsom soak itself and so on. But yeah, I've been finding that the Epsom lotion is really, really amazing. All right, so I've got my sidekick here in the studio, fast asleep on the job. He's right here in this chair. I'm going to turn him this way. He was a little bit under the weather last week, and I was getting a little bit concerned on Saturday, and I was thinking if I should take poor Zeus to the vet. But then by later on Saturday, going into Sunday, he was perking up a little bit. So you notice he was just very lethargic, and he like wasn't, listen, they're known as a lazy breed. Like seriously, Shih Tzus were bred to just sleep all the time, I swear. But they're lap dogs, right? So he has a lazy streak anyway, but then he gets perky certain times of the day. When he runs outside, he gets the zoomies where he's like running up and down on the lawn. And then even within the house, he wants to play with his toys. And when you see him like not interested in his toys and all that stuff, it's not normally a good sign. So I was kind of like, he's a bit under the weather. But thankfully, he seems to be feeling a lot better. And he was pretty much back to himself by Sunday. So I was really happy to see that because I was getting a little bit worried. You know, he's like my little baby. So, sometimes they get off. And I think probably with him, it's normally his diet, like something he's not supposed to eat. He, has put something in his mouth, normally on the outside. Once in a while, I'll give him like a little gravy or something to kind of spice up his dinner. But I don't try to give him anything that I think is going to upset his stomach, like nothing too spicy or too many seasonings or whatever in it. But yeah, he likes to put stuff in his mouth, honey child. He's like a baby. So I do keep an eye on him in terms of that. So he probably ate something, although his stomach didn't really seem like it was off, but something was throwing my little Zeusy baby off. But he's good now. He's napping. All right. So what's going on? We have car thefts. I think this car is still missing. We have car break-ins in the same complex. So if you have any details on that, please reach out to the RCIPS, call 911. Someone actually called me yesterday because they thought that they saw the vehicle in question. And it was another, once I gave them the license plate number, it was actually another vehicle. But I'll update the post because I'm not so sure that we actually put the license plate number in the post. I thought we did, but when the person asked me, I had to think twice about it. I thought, did we or didn't we? All right, this is a busy week for me because I do have court. Do not comment in the section about in the comment section about it. On the show, I don't have any intentions of talking about it. There is a bit of a gag order in place from the courts because it is a jury trial. So I'm not able to say anything other than we report the facts. So obviously I was in court yesterday. I told you guys I was going to court. And then we report the facts afterwards in terms of what happened. Trial starts tomorrow. At this point, that's pretty much all that I can say. And, after the trial's over, then we can obviously have a lot to say about it at that stage. But don't say anything, we can't get into really any of the details. All right. So thank you all so much for all the well wishes, and those comments are much appreciated. Okay. So I'm just having a quick look here. So why don't we do, some of you were asking me if there's any updates in terms of what is happening in the case there in Jamaica. I had someone message me over the weekend wondering why the RCIPS isn't on the ground in Jamaica trying to help the police in Jamaica solve this case. Well, I think a couple things going on here. I don't know that they can just show up to Jamaica without an invite. So in other words, the Jamaica authorities have to invite them. And number two, I'm not so sure that they have any more expert knowledge. Like, what would be the point of them going there? I'm assuming the point of them going to Jamaica is because we actually want them to, help solve whatever happened to young Michael McLaughlin. And I don't think that they have the expertise any differently. In fact, probably the police in Jamaica are more equipped. And from the perspective of experience, because they deal with a lot more cases, a lot more murders. Hopefully their detectives are more experienced and they kind of know what to be looking for, right? I don't know that our police would offer any real assistance. And, All right. So I don't know. What do you guys think about it? Do you think that, having attorneys, having the police, RCIPS there would make a difference? I don't think so, right? Now, I have seen, and I again want to extend my sincere apologies and condolences to the family about this, because I know this has to be a very, very difficult time for them. I've seen his girlfriend posting a number of comments and videos about the fact that she does not think that this was accidental. She doesn't think that he just fell off of this balcony, that she thinks that they killed him. And yeah, I think anybody probably with, little bit of understanding of who he would have been dealing with. That's probably what happened. They probably killed him. Really, really sad. Yeah. But I don't know. I just don't know. So sad. And everyone says he was such a good, nice kid, a nice guy. And so what I want to say is, the most interesting thing about this for me is that you can be a nice person, but you have to understand that when you are hanging out with criminals, no matter how nice you are, they're not nice people, right? So they can never be trusted. When it's like money involved, I think everybody accepts that he was going there to, even the Jamaican media was saying he was going there to try to get a shipment ready to come to Cayman. These people are criminals. You might be thinking to yourself, oh, he's just bringing in just a little bit of weed. But the people he's dealing with, they're not in just a little bit of weed. They're hardcore criminals. So, they're running guns, they're running weed, they're running anything that can make them money. If it's the weed that's profitable, they're going to run that. If it was meth that was profitable, they're going to, Jamaica just, farming community. Jamaica is more known for the marijuana than anything else, really. But even the cocaine, like whatever they can run, they can run. And these people are using that money for other activities, to buy guns and to do other things. So they're not nice people. They're not your friends. And I'm hearing all kind of things on the street here in Cayman about other people, involved. Yeah. Mm-hmm. So I kind of feel like it's just, I don't even know what to say. It is just a really, really sad situation. He had at least two kids. He might have had an older child as well, but two little twins. And they're just so adorable. Oh my gosh, the little girl especially is so cute. And now, they have to grow up without a father. So it's just a sad situation. And so I don't even know. Anyway, I guess they're going to be, I heard family was going, are they going to actually bring the body back? I guess Cayman Airways can assist with that. And it's a lot to bring, if you're bringing the whole body back as opposed to cremating it, it's quite a bit of work normally involved in that, but I guess they'll bring the body back. So Marshall says they can hardly solve things in Cayman, so there's no need for them to go to Jamaica. That's kind of what I thought too. When the person said it, I'm like, well, what would be the point? And they're like, oh, but they always, we've sent people to Turks and Caicos and sent people here and there. And I'm like, we send like relief. Sometimes we have sent people to TCI, but, I guess that's to give them more boots on the ground. I don't think Jamaica they don't need more boots on the ground. They've got their own, I guess, experts there. So I don't know. I don't know how I feel about that. When it was suggested, I'm like, I'm not going to bat up the RCIPS over this because I don't think they're going to add anything to the investigation. And, low key, there was like really suspicious things happening even before the police probably got on the scene. And yeah. So I don't know. But in addition to that, I would say that there are a number of other people connected to the situation locally. And I know, now they're thinking they want vindication for their friend. Guys, be smart about this. Like the tit for tat violence doesn't get you anywhere. It's not a legitimate business. So it's not like you can go there and now be like, oh, I'm going to take over his farm or his employees and start to run the business. I don't know who in Jamaica had their eyes on the man's marijuana farm, but somebody obviously did. And so now I would say to all the Caymanian youths here, they think they're bad boys and whatever, walk around with their guns and that sort of thing. It's certainly not worth your life. So please just relax yourselves. You've got parents that are going to grieve for your loss. And so in my mind, you guys need to find another job because that ain't it. All right. Bringing drugs into this country just are not the solution. And it's just really, really sad. It's sad to know that our own people are even involved in this type of activity, quite frankly. But there you have it. Anthony says it's sad that Caymanians would leave their beautiful homes and end up in pathetic looking locations as the house in the news picture. What a mess. Yeah, I mean, I saw that house and I mean, it's big, but big doesn't mean that it's nice, right? And this Popeye News, people have been sending me this video from over the weekend. So this Popeye News agency, or not really a news agency, but street news in Jamaica. They're very, very popular, actually. These street news people are really, really popular. But they had a whole thing on it. Do you hear how they pronounce McLaughlin when they say it? I think it's a Jamaican thing, but they don't say it McLaughlin like we do. They say, I'll have to get it. Hold on. I'll show you. Popeye News link. So this has been circulating all weekend. And the one thing that they say in there that's kind of odd is they talk about the fact that there was like blood on him, but there's none in the pictures and videos that we saw. So I don't know if somebody tried to clean him up afterwards. Like the whole story doesn't really make any sense. I think that, we obviously
on your screen.
Oh my gosh, he's so loud. Hold on.
Is Michael Matthias McLaughlin. He was 35 years.
McLaughlin. So they don't say McLaughlin. They say McLaughlin. Which word are they missing? Which syllabi? McLaughlin. So they don't say the G. McLaughlin. They say McLaughlin. Okay.
And Michael, he was living at Velma Banks Drive in Grand Cayman. No. We are told by law enforcement.
It's so interesting how, anyway, he claims that this guy, I don't know who this is. I think he might be former law enforcement or something, is what somebody told me who watches this Popeye News links quite frequently on YouTube. But he was saying that sources both in Cayman and Jamaica is where he's gotten his information from, like Jamaican and Cayman police. And I thought, okay. Well, did the police here even issue a statement? Hold on. Now that I'm thinking about it, give me 1 second. RCAPS. Let me check their website. I kind of don't think that they did, press releases. I don't even think our police here have, let me see. Police investigate robbery at Harbor Walk. I want to talk about that here in a second. Operation Cairo. Yeah. I mean, this is a bit strange, but the police actually haven't said anything about this. Now, okay. Does that mean that they're not even in contact with their partners there to inquire about this? I don't know. It's kind of weird. Low key, I'm like, okay. Honey, chill. What's going on? But yeah, they didn't say anything about it. Wow. I know we covered it as a news story, but I was wondering if Renee saw something from the police, but I don't think so. Nothing's on their website. Okay.
Officials, both locally and in the Grand Cayman, that Michael.
Now, I don't believe that. I mean, people might be saying stuff unofficially to him, but I don't think the police have said anything because they've not even said anything locally. Like they haven't even put out a press release. So I don't know. I don't know what that means, but okay.
He was a well-known drug dealer. Some people are go vex when them hear this, but our information is that Michael, he was a well-known drug dealer. He moved drugs by boat between Jamaica, the Cayman Islands, and other countries. We're learning that Michael.
Which other countries? I mean, I know about that part. I think the route and the connection was just Jamaica to Cayman. But anyway, he says other countries. I don't know what other countries would be involved because normally these guys come straight Cayman. It's Cayman, Jamaica, back and forth.
He arrived in Jamaica via the Norman Manley International Airport in Kingston on Tuesday, March 24. It is said that Michael, he was visiting Jamaica to coordinate the shipment of some drugs. Michael, he was picked up at the airport by a friend and taken to that house on your screen. That house is at Bronte, near to Kilmarnock in the parish of Westmoreland. We are learning that Michael, he met with a few persons all day on Wednesday. The last person he was known to have met with was a guy known as Starkey from Montego Bay. Starkey, he had gone to the house to visit Michael. It is said that Michael, he was seen talking to Starkey at minutes after 8 o'clock, and it is not known what time Starkey left. Yesterday morning, Thursday, March 26, about 7:30, a resident of the area stumbled upon Michael's lifeless body at the front of the yard and alerted the guy who is living at the house. The said guy who had picked up Michael at the airport. The police, they were called in, and when they inspected Michael, he was seen lying on his back with blood coming from his mouth. And
that part of the story now, we didn't see that in anything that we've seen. So I don't think that part is right unless this Popeyes Newslink guy knows something we don't know and they cleaned him up. Because the pictures didn't actually, there's pictures and videos in circulation and we didn't see that at all. So either that's completely wrong, and I'm not sure where he's getting that from, or he knows a bit more than we do. And then somebody actually cleaned up, poor Michael. I mean, I don't know, I'm not swearing for none of this and how this will go.
His nostril. He was dressed in a red t-shirt, a black pants and barefooted. Michael was.
And you could see in one of the pictures I saw, I think those were his slippers that were like close by. So he wasn't exactly barefooted. It looked like the slippers came off. But the whole thing just, I don't know, boy.
We are learning that Michael, he was supposed to be heading back to the Grand Cayman today. A postmortem examination will be done to ascertain Michael's cause of death. But in my mind, I have no doubt that Michael was killed. The questions are, by what means and by who? Keep on watching this space, because as soon as more information becomes available, I'll be updating this report. Stand by for that.
All right. So very, very sad. I think the conclusions are probably about right in terms of what happened to him. Okay, he's killed, but we don't know who. Looks like they just pushed him off the balcony, perhaps. I mean, that's certainly one way of killing someone. And then it's hard to say if that was a push or if it was a fall or if it was accidental or, listen, those who are close to Michael said he was afraid of heights. So he was not a person who would go out of his way to probably be like hanging out on a balcony. To fall in any instance. And so they found that even that method of him allegedly losing his life that way, because of course we'd have to wait for the police to confirm that he died from the fall. But all of it, they say, sounds really, really suspicious. They wonder if he was like drugged or if they just pushed him or if there was any kind of altercation. Like, we'll just have to wait and see what the police, and I do think, the RCIPS hasn't said anything. And I do think when a Caymanian national, under any circumstances, quite frankly, dies overseas, it would be nice to hear something from the police. Like I said, they're not going to run over there and try and solve this, but I do think it would be nice for them to say something. I mean, like, we're working with the authorities overseas, or we're not working with them, but they're going to just keep us updated. Something. They've said there's been like radio silence on this. So Popo, where y'all at? I would like to hear a little something that you've heard about it, that you know about it, that the police are investigating something, but they've said nothing. Marshall says, well, clearly he shouldn't have been there. When you're up to no good, bad things will happen to you anywhere you go. It's unfortunate because, again, he is hanging around criminals, obviously, if that's what he was there doing. He liked my story that Wednesday at 10 p.m. So surreal. So Abby, you were friends with him. It sounds like on social media. Yeah, it's really sad. Irvin says they can do a picture cleanup in order to post the pictures. The people that he was hanging out with, I doubt that they're going to be doing all that. But anyway, we'll see. So I think obviously they'll do things like toxicology report. People said he wasn't a person that would get drunk to where he wouldn't know his surroundings, that sort of stuff. Like he wasn't a big drinker either. So I don't know. I don't know that the family will ever get closure. This is Jamaica we talk about, folks. People get murdered every day and they don't get solved. So, I don't have high hopes of that happening. But I think it's just very, very sad. Or Island Pearl says it's very obvious that the guy that picked him up set him up. Well, he was going to stay with these people at that house that you saw in the video. And my understanding is that his farm that he has is in very close proximity to that house. So, I guess he thought he knew these people. Thinking you know somebody and actually being able to trust them are two very, very different things. And that house, there it is right there. That, that's another one of those houses they've been working at for years. And, up on the hill, big house, probably built it with drug money. Yeah, so that's where he was staying. You can't trust people. You cannot trust people, honey chill. No, sir. One thing I know Popeyes will find out the truth, says Angela. I'll leave it up to Popeyes to inform us in terms of what's going on. Oh, no, Auntie, the blogger that posted pictures. Oh, I don't know about any blogger that posted pictures. We got raw photos. We didn't get any blogger posts. We got raw photos of poor Mikey. And like I said, I didn't actually see any blood in any of those. We got video, we got, and supposedly there's a lot of like rumors circulating, but supposedly they called or sent his girlfriend a picture of him or mom a picture, some mixed up story. It's just wild. It is just wild. So sad. The Texans in Jamaica, says Irvelin, are very good. Them here might just go complicate things. So let's talk about the Bolo case. Right. So his nephew was found guilty. And I will be honest with you in that I wasn't personally following that case extremely closely because, Renee was on top of it. But he was found guilty on Friday, I believe. And what can I say? I mean, it was a very long case. Lots of witnesses. I think they had like over 27 witnesses. And it was a jury case. So, of course, that limited what we could say as it was happening. The judge overseeing it was Cheryl Richards. You can't get into jurors' heads. They sit there and they listen to all the evidence and they come to their conclusion. Sometimes they get it right. A lot of times they get it right. Most times they get it right. And sometimes they don't. I don't know what to make of this. This is Demesio Frederick, which would be his nephew, Christopher Bolo Johnson. And I just think that it's a really, really sad situation that this has even happened. So went into like 3 weeks, testimony from 27 witnesses, and they found his body in the early morning hours of December 31st, which was New Year's Eve, 2024. And at first they weren't even sure how poor Bolo died, but eventually they said that he was found less than an hour after he dropped his son off at work, and medical evidence confirmed that he died from compression to the neck, which was consistent with strangulation. Wild. So basically the Crown's case centered around a breakdown in family relationships, of where there was like some theft. Frederick had confronted his uncle following a theft of more than $20,000 in cash and jewelry from the home of Frederick's mother. Who keeps 20 grand cash? Y'all be balling in a different kind of way. 20 grand in cash? Where y'all getting that kind of money from? You're lucky if you found me with $20. What? That is some $20,000 in cash and jewelry from the home of his mother. On December the 6th, the confrontation, prosecutors argued, turned fatal. 20 grand. I'm still trying to work my brain around who keeps 20 grand in the house and where's that money coming from? I've got questions. Anyway, so they central to the prosecution's case was DNA, which is recovered from beneath the deceased's left fingernail. Ooh, honey child, that DNA evidence with forensic evidence said cannot exclude the Monsieur Frederick, and it was a likelihood ratio of 1 in 50. Listen to this now. Septillion. What the hell is a septillion? Hold on, let me look that up. Sept means normally 6 or 7. Septa is 7, I think. Septillion is a cardinal number equivalent to one followed by 24 zeros. So it's like 10 to the 24th power in the American and modern British short scale systems. I mean, so it represents a trillion. So 10 to the 12th power times 10 to the 12th power in short scale. Wow, that's a lot. A septillion is a lot. 1 septillion. Yes, derived from Latin septem, which is 7. So sept is 7, and then 6 is very, very close to 7 in terms of what it looks like in Latin derivative. Anyway, that's wild. That's a pretty convincing DNA number. I gotta tell you the truth. So 1 in 50, not just 1 in 1 septillion, 1 in 50 septillion. That's pretty convincing. So yeah, and you know the crazy thing is, once you come in contact with people, the DNA exchange happens so quickly that you can try and clean the body up and whatever, but a lot of times, Additional hairs were discovered from between the victim's thumb and forefinger and on a white T-shirt found near the body. Oh my God, DNA evidence. Hard to argue with that kind of DNA evidence, boy. Frederick took the stand in his own defense, arguing that the DNA could be explained by a separate physical altercation with his uncle days before the killing. Not likely. He also suggested trace evidence may have been transferred during earlier alleged thefts by Johnson from the family home. He did not call a forensic expert to counter the prosecution's DNA statistics. All right. The defense challenged the integrity of the police investigation, citing blank pages in a senior detective's notebook and questioning whether crime scene investigators wore full protective overalls, and those concerns did not sway the jury. Johnson's son testified about the last moments he spent with his father and described long-running family tensions, including a property dispute dating back to 2017. Oh, God. A building connected to that dispute was subsequently destroyed by fire following Johnson's death. Lord God, Awagwan. I can't believe y'all be fighting over stuff like this. Like, I ain't not fighting over no dead left. I'm sorry. I came with nothing. I'm leaving with nothing. And whatever I have in between, I can work and earn on my own. No, Bobo. No, sir. Strong Wilt says Bolo was a nice guy. Strong Wilt says, I heard it was about land. It sounds like it was all kind of family mix up there. It's so sad. Aisle 2025 says, is it true that none of it was his to fight over? The land, the cash, the jewelry. Also, only sketchy people keep that much cash. What is the mom into? Like I said, you're lucky if you found $20 around you. Once in a while, I'll find money. Like the other day, I was cleaning out something. Spring cleaning time, I've been going through my file cabinet, shredding, and oh God, don't talk to me about shredding. But anyway, I've been going through stuff and cleaning out, and I found a thing with maybe $100 or something like that. And I was like, oh, spring cleaning money. And that's why I don't keep money around the place, because I'm the worst with it. I'm always putting it down and it gets lost and I don't even remember I had the money. Why was a video of Miss Sabrina Turner taken down yesterday? She was discussing the alleged fraud committed by some nationalities in Cayman. Louise, taken down from where? I'm pretty sure it wasn't taken down, but I don't know where you think it was taken down. Let me check CMR page. I doubt it. I mean, we certainly don't take any videos down, and Facebook doesn't normally take videos down unless there is some sort of issue with like copywriting music and stuff. No, the video is there. 15 hours ago. Nope. Still right there on Facebook, honey child. 6.7 thousand views already. Go watch it. Go watch it. Go watch it. I'll give it a like. Yeah, so it's not taken down. I mean, I don't know why you think it's down, but it's on the main page, Luis, right there. Good morning to Miss Marva. How are you, darling? Irvlin says, how has boy and they all gonna die and leave it? Oh yeah. I mean, Luis, it's still there. I watched it late last night and I'd missed the first part of it. No cash in my house, $20,000. Oh my God. Yeah, that's kind of low-key suspicious. Not even low-key, that's high-key suspicious. Ay, ay, ay. Oh Lord, people call me the Tiefin sister is greedy, blah, 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 expletive. Oh Lord Jesus, I can't get into these people family drama. They said a family feud has been going on for years. Oh wow. Poor Bolo. They try to get him out the way so he wouldn't take them to court. I mean, I cannot believe that y'all are fighting over people thing. All right, so okay. All right, that was we thought we had a video we were going to be sharing, but then they said they're going to double check it and get back to us. Okay, no problem. All righty, hot mess. I don't know. I don't know what y'all fighting about. Hot mess. Boy, I tell you what. Lord God. Marva says, I was hospitalized a few weeks ago. I'm home now. Thanks for asking. Oh my gosh, I'm so sorry to hear, but I'm glad you're on the mends and recovering. Aisle 2025 says family compounds rarely work. It's usually just a bunch of adult kids who never left, eventually fighting over an inheritance that's worth pennies once it's split up. Especially because there are like so many people to split it by, right? But I think when you have kids, parents, y'all need to do a better job too of like having a will and making sure, you know, even before anything happens to you, have living wills and make sure that people know clearly what you're going to do. Because a lot of people just fly with it and they don't have a will, they don't have anything. And then when something happens to them, it's all kind of mixed up story. And it doesn't even have to be that you die. Sometimes it's just that, you know, somebody was telling me about a person and came out and now they have dementia. And one child is doing this with them. And another child, you know, is upset in their feelings because they're burning through what will be the inheritance money. And it's just wild. Like the whole thing just sounds crazy. And so, you know, have your business organized and situated and stuff. That's the best advice that I could really give. Yeah, it's pretty wild. It's really sad though. Very, very sad. All right. Let me just see what else was making the news over the last couple days that we should do a Ask Sandy segment. So tomorrow is Wednesday, but because I have court, I was a little bit late yesterday and I cannot afford to be late. So what I'm going to do is tomorrow we're going to play some highlights from the Red Sky at Night event. So I will leave out extra early and pre-play those highlights in the show. So look forward to that. It's actually really, really good this year. I must say I quite enjoyed it. And what I would also say is because we had guests in the studio yesterday, they came in at 9:00. It was a little bit after 9 before we got to them. So there was that. So big shout out to the government. they're trying to do an overhaul of the fuel sector regulation. I don't know why, but I thought that the people who were licensing the fuel sector was actually off-reg, but it turns out that legislatively that's not what was happening. So they're correcting and fixing these things with the view to then being able to make sure that everything is aligned when it comes to like the cost of living and just overall regulation. I think that makes like logical sense, right? We had a couple events over the weekend that included arrests and criminal activity. People being arrested for ammunition in Ganja and West Bay. We had a man who robbed another man after asking him to help change a tire. Like, what on earth? So listen to this. Police are urging the public to stay alert after a man was leaving the gym on Friday, was robbed after being lured into a secluded parking lot under the pretense of helping change a tire. 10 p.m. at night? You are not walking up to me at 10 p.m. at night and get me to go anywhere with you. I'm sorry. But you're not even walking up to me without me screaming. And if I had pepper spray, I'd be spraying you in the face. Just start screaming right away. Because no sensible person can just walk up to you. If they needed help changing a tire, go inside the gym. I'm sure there were other people working out at 10 o'clock at night. You know, those crazy people who want to be getting some muscles that late at night. Not me. They're committed. So the police are investigating this robbery. Occurred in a parking lot. They say Harbor Walk off of Shamrock Road. Oh yeah, there is a gym up there. So according to the RCMPS, just before 10 p.m., officers responded to reports of the robbery. The victim told police that he was approached by an unknown male who asked for help changing a tire. After following the suspect to a secluded area of the parking lot, the man was assaulted and a gold chain was forcibly torn from his neck. Hot tamales. We do have footage, but this is the same one that I think they're now asking us to hold off on so that they can get some additional information. So we do have some footage, but let's wait. They're going to get back to us. But the crazy thing is, there were like a ton of people. Suspect number one. Oh, I'm looking at it. Oh, they got the suspect number one. So there's more than one suspect. I mean, there were people in the parking lot. Is that like suspect number two? There were actually other people like standing there in the parking lot. Child, don't make nobody, nobody can't. And what are you doing wearing a necklace to the gym? Am I the only person that when I used to work out, I don't wear no jewelry. Everything comes off. I don't even like to take it to the gym because, you know, that's how you be losing stuff when you put it in your gym bag. And then next thing you know, oh, they got these two suspects. Oh, they got pretty good videos of the suspects, though. If that's them, y'all can know exactly who these brethren is. I suspect that when we can show this video from Friday, you guys are going to be able to identify them. Oh, yeah. We got the video on the channel. Ooh, okay. I'm just waiting on the word to release it. And then after the robbery, okay. I'm going to try and get this. Once we get the all clear, we'll post it up because I think we might have some good leads for y'all. But anyway, yeah, wow. I don't wear gym. I don't wear gym to the jewelry. I don't wear jewelry to the gym. Take it off. Not even the earrings. You take it all off. No rings, no earrings, no nothing. Just plain Jane. No necklaces, nothing. Just the gym clothes and your shoes, and you have your little towel. Y'all be flexing all the time. All right. Strong Will. Morning, Siobhan. How you doing? So good to see you. Miss Joy's in the house. Bolo's nephew had such a good job. He just ruined his future. Yeah, it's so sad because he actually worked at I think CUC, right? And say what you want to say, but boy, CUC is a good employer. Everybody who goes there wants to stay there. They don't want to be leaving. So, yeah, Bobo, that's quite a few years in jail now. Twin of us says, I was given the ultimatum to receive inheritance money or continue to stay with my grandmother. Money turned people into idiots. You were given an ultimatum? Why? They wanted to tear you away from your grandmother? Oh my gosh, people are crazy. Anthony says, I keep saying and continue saying the cost of living will sum up this government's term in the next election. As much work as they have been doing, the biggest thing they could have done was put a stay on minimum wage. Well, perhaps, Anthony, but that's not even what's going to be driving the cost of living. What is going to be driving the cost of living is our dodo brain friend over there in the United States of America called Donald Trump. And his war is now going to push up the cost of fuel. And like everything he's done has negatively impacted the cost of living. He's not helped anybody except his rich friends. So what can our government do about that, though? Nothing. They campaigned on increasing the minimum wage. So, of course, if they didn't do that, then y'all would be custom about that, too. So, I mean, I wasn't really that big on I fully understood from day one that the increase in minimum wage was going to come with a lot of trickle down unintended consequences. And y'all just were not paying attention. Dean Sinclair, good morning. Good morning. Since family issues can get really ugly for real, especially over inheritance when one passed away. I have a brother and sister younger than me, younger than I would kill me if I lay myself careless for same reason. You might want to fix that last bit for us. So the owners of the CCTV footage have asked us not to release it. We do have it. And I think it's something they're talking to the police still. So time is of the essence. So if you watch the first 48, you'd know that. Ms. Vicky says you would have to drive that car on the rim before I go into a dark parking lot to help. Right? Even then, I'm not helping you. Sorry. Sean says he's going to spend a few full moons up and northward. Patrick Bodden says, Sandra, stop blaming Trump for everything. Well, I'm not blaming him for everything. I'm not blaming him for the spin of the earth, the axis, the rotation, the moon. I'm just blaming him for the stuff that he does, which includes impacting the cost of living. Did you guys see this last night? You got to watch this video. I'm going to do some video clips on it and play it. But you know that he has started this war, right? And when he's asked about it now, the dude pretends like it's not even happening. He pretends like Iran isn't a thing. He told us that the war was going to be over in a couple of days. I guess in his head, it's over and he's moved on, right? So he's not worried at all. A Fox reporter asked him whether or not the people in Iran might be starving or having some difficulties because of the war. And he said, yeah, I remember the time that you and I went to lunch many, many years ago. And I think that you're so beautiful. And I was like, what? I mean, I don't make this stuff up. It's an actual interview. Hold on. This woman, and then he's like, if I tell you that you're beautiful, maybe I won't get elected again. I can't believe that you guys can logically understand anything this man is doing, because it's all crazy. He was cussing out the Supreme Court, and they said, he said that because I guess they're not giving him what he wants. He said they're a bunch of idiots. Well, you put them there, sir. It's your Supreme Court. You put them there. So if now you want to claim that they're a bunch of idiots simply because they don't agree with you, because they actually are trained lawyers. So at some point, they probably have to rein themselves in. Yeah. So I'm trying to find this video clip because you actually have to watch it to understand that this man is not playing with a full deck. So Dana Perino asked President Trump if Iranians are starving amid the war, and he chose instead to compliment her looks and recall a lunch that they once shared. She's on some show called Fox News talk show The Five, and this happened on Thursday. Wow. He just lives in a world of his own. He creates the world that he lives in, and it's just like, okay. Anyway, of course, they all pandered to him, and they all kind of did this awkward chuckle where they're like, you know, when you know that somebody is off, and let me see if we can get a clip of this, because it was just like weird. Let me see. Is this it? Okay, hold on. Let's see. Let me see if we can find that clip. It's just really bizarre. I don't know how else to explain it. It's just really, really weird. He just like, oh, remember when we had lunch many, many years ago? I could talk about how beautiful you are. And it's like, did you hear the question, sir? It's bizarre. I'll find the video clip because, you know, y'all not gonna believe it if you don't see it for yourself. Let's be honest. I think I saw. Hold on. I think I saw a clip of it last night. I'm just trying to remember where. Did you guys see his ballroom photos too? Those are so funny. We haven't had a Trump day in a while. We got to have a Trump day because yeah, it's pretty wild. It's pretty cray. Anyway, I'll find that one and I'll put it up because I know you guys can claim that he didn't say it unless you see it for yourself. So, okay, we can make that happen. I think it's this one. Let me just hold on. I'm going to find the segment of it so that we don't have to watch the full thing. Where he's like, "You're so beautiful. Iranian suffering? No, but remember when we had lunch? That's what matters." See, when I tell you fake news, don't believe everything on the news. So Fox, you're trying to say that Fox is now producing fake news because he was on Fox News. Surely you can't be saying that. What are you talking about? That doesn't make any sense. Fox would never, ever engage in fake news. What? Are you kidding? Oh my God. Seriously? Anthony says fuel/energy is like your mortgage, but no matter what it increases to you, no matter what it increases to, you have to pay it. So trying to control a few cents will not reach the lower middle class. Well, that's why removing the duty on it doesn't really make any sense, but it's still fuel, but it impacts everything. It fuels everything. But that's not the only thing that is being impacted by Trump. Like your pensions, your investments, your mortgage rates now are going to be impacted. All these things are becoming, yeah, it's crazy. So KY Forever said, if my grandparents ever leave me a lump sum of cash, I'll put on a car, depending how much they give me, and use the rest to fly, because I'll be damned if these children think they can come after me for it. No, sir. The worst thing you can do is put money in a car that your grandparents leave you. That don't make no sense. That's throwing money away, quite frankly. But I mean, you can do it. I'm not saying you can't. Everybody, feels like they want a nice car, but that's, yeah. Some people have that philosophy though. They're like, I'm not going to leave anything for my kids or the next generation, which I think is the wrong mentality. I think you just have to organize it properly if you have more than one child. And even when you have one child, there's certain safeguards that you should put in place. There was I think they were Chinese people the other day. They're like billionaires, right? And so they've come up with a strategy, an investment strategy. I think it might be a trust structure or something, but basically it guarantees wealth for like 100 generations or whatever, so that no one single child, grandchild, great-grandchild can come in and mess up the family fortune. So if you have sense along with money, there are ways that you can secure future generations, right? And stop them from doing certain things. So that's where you got to be smart. You don't just go, well, they're going to run through it anyway, so what's the point? I might as well run through it. That kind of doesn't make any sense. So we wonder why people like Larry laugh at us Caymanians. Larry not laughing at y'all. He just pulling y'all out of cars and trying to beat you. Imagine all what's going on in Cayman. Trump is on your mind. Really? Yes, Patrick. A lot of what's going on in Cayman is directly related to the US and President Trump. You can't be serious with that statement. We must ignore what the Americans are doing because that has zero impact on our lives. Go to the gas pumps and tell me that again. I mean, really, you cannot be serious. Oh my God. You can defend him, but you can't come on here and defend him with illogical statements that don't make no damn sense. I'm just saying. Wonk, 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 wonk. But we'll get to Trump Day. I'll let you know when it is, Patrick, so you can get in the comment section and try to defend his nonsense. All right. Very good. Good morning. The fools that support him are the ones of concern. Amen. Still can't believe Caymanians are still blinded by Trump and his actions, especially when the global impact on all of our lives, especially with the global impact on all of our lives. Do they know that they can change their minds with all the additional information? Anonymous, please. Boy, they're committed. I wish some of y'all were committed to your marriages as much as you are committed to Trump. So, hot mess. All right. Someone has lost a birth certificate. The name is Dapson Hugh Dennis, Jamaican birth certificate, there by the Compass parking lot. That was yesterday morning. So if anyone has found a birth certificate for Dapson, D-A-P-S-O-N, Hugh Dennis, please reach out. Okay. Yeah, lost their birth certificate. Oh man, that sucks. All right. I'm going to just let me just find this Fox News bit. Is this not the one from last night? Hold on. I'll find it and play it later on. Okay. All right. We have some Q&A. I'm thinking we got to do a Q&A section soon. I saw someone send me a very lengthy message about landlord issues and stuff. I'll try to respond to them with my non-lawyerly response. So I always remind people I do have a law degree. I have done even the PPC, but I'm not a qualified lawyer. So I always tell you, go get yourself a qualified lawyer. I mean, I might understand a thing or two about contract law, but I'm not giving you advice as a lawyer. I'm just giving you advice as Auntie Sandy. But I find that there's a lot of landlord tenancy issues that unfortunately, people just don't know how to navigate. And some people are landlords themselves and they simply do not do a good job, which is kind of sad, but they do not do a good job of actually being a landlord within the confines of the law. So a lot of things they do as a landlord are actually against the law. They breach in the contract and all sorts of other things. And it's like, they just don't understand, and they think that it doesn't matter. And I guess in most instances, a lot of people are simply not, you know, they're not providing, what on earth is this? They're simply not providing any, they're simply not providing, you know, the terms that are in the contract. Sometimes they don't even provide a contract, but the terms that are in the contract, and there's certain things that you can't put in a contract that people don't seem to know either. So it's just a mess. And I always suggest that you have someone look over your lease. If you're not familiar with the legalities of it, have someone look it over so that you are not getting in a situation that then it's very, very difficult for you to get out of. Because once you've signed up for certain things, yeah, it's very, very challenging. So, it's a 10-year anniversary of the Panama Papers already? Oh, wow. Okay. Interesting. That's amazing. So it's coming up, and a few people are doing some corporate stuff around it. The Panama Papers 10-year anniversary. Ooh, interesting. All right. I think that's all I got for you today. And we're going to end in time today, and I've got some work. I actually have to go meet some clients and stuff in town, and you'll soon see a major project that I have been working on, and it's been, taking up a bit of my time. But I am really, really pleased to say that it's come along nicely, and we're like at the finish line, with a few bits and pieces that we're still kind of getting into play. So yeah, no court today, court tomorrow. So at about 9:00 tomorrow, I'm going to queue up some video that I prepared for you guys. And then on Thursday's show, we are going to have a Cayman Voices segment aired as well. So really, really excited about that interview, which I did when I was in Tampa back in February. So super excited. Oh my God. Vicky says nasty land problems been going on in Cayman. There's a case in the early 1950s where a Georgetown older poor Black lady house was wrapped around with rope and set on fire just to get her out. What on earth? What was her name? I'm going to go look in the archives and see if I can't find that story. Say what? Oh my God. That's crazy. Gabby says, if you have no interest in what's happening in the rest of the world, go over to Radio Cayman. CMR is not for the small-minded. Thank you, Gabby. Thank you. Thank you. Oh, Strongwell says, kaboom, Sandy. Oh my gosh. Y'all need to do better. Yeah. Oh my gosh. They be up in their feelings about Trump. I still can't believe it. I can't believe that y'all defend stupidity. Kind of special. Anyway, that's all I got, folks. Got to get to work. I got some cleaning to do today. I was sweeping and stuff yesterday. Somebody said, why you don't have somebody do that for you? Yes. Sometimes I got to do it myself. Calm down. It's not all that serious. But today we're going to start doing some deep cleaning. So I'll see you guys tomorrow. All right. Be good. Sidekick Zeus is sitting here with his eyes open, which means he's not really fully asleep. And then he starts to close his eyes ever so slowly. Then he's like stretching. He's like, oh, let me do a big stretch here. Oh my gosh, he's the cutest little thing. All right. See you guys tomorrow morning. Please enjoy the rest of your day and be super safe. Bye-bye.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.